COVID-19 measures at fishery ports will be enhanced, including at Jurong Fishery Port when it opens on Saturday. China's SINOPHARM vaccine could soon be offered by private healthcare groups in Singapore. And Yu Mengyu is through to the semi-finals of the women's table tennis at the Olympics. Hello, I'm Haryanto Diman and you're watching The Big Story live in the Straits Times newsroom. You can subscribe to our channel so you never miss a single episode. When it reopens this Saturday, July 31st, Jurong Fishery Port will have tighter COVID-19 measures at three main areas: the entrance, marketplace and unloading area. All authorized entry pass holders must undergo testing prior to entry before they transition to a 7-day rostered routine testing regime. All foreign delivery drivers must remain in their vehicles for check-in and temperature taking. They are prohibited from alighting to reduce intermingling. Access into the marketplace area will be restricted, including limiting the number of seafood traders within the premises at any time. Tenants and workers will be segregated and shouldn't mingle. They will also have separate toilets as well as meal and smoking areas. All unloading activity must be supervised by safe distancing ambassadors and will be monitored via CCTV as well. Fish containers like boxes or crates will be disinfected before collection. Workers must keep their distance as foreign workers unload the goods. They can only pick up the goods after the foreign workers move away from the designated area. All workers must adhere to a hand hygiene and sanitation regime and must wear their masks and gloves when they pick up the goods. All these measures are already in effect at Senoko Fishery Port.
We want Senoko Fishery Port to be a safer place from a public health point of view because it's such an important part of our food supply chain. As you can see, a cluster here will inundate the facility and it will also possibly put our community at risk. So for the well-being of the workers here, for the trade visitors here, and also from the community at large, we want to strengthen the control at Senoko Fishery Port and also in Jurong Fishery Port when it reopens.
Now, moving on to the KTV cluster, among the foreign hostesses linked to it, fewer than 50 had valid work passes. The Manpower Ministry said these work pass holders had been allowed to perform non-hostessing jobs since October last year, after their employers temporarily pivoted to permitted businesses like F&B. When asked about the number of hostesses linked to the cluster on a social visit pass, MOM didn't give a figure, but said foreigners with these passes working as hostesses are in breach of the Immigration Act. China's SINOPHARM vaccine could soon be available in Singapore, with private healthcare groups already taking steps to secure their doses. IHH Healthcare Singapore said it's received approval by the HSA to import the vaccine under the Special Access Route framework. While in a Facebook post, Raffles Medical Group asked people to register their interest. Across the causeway, Malaysia reported a record daily high of 17,405 COVID-19 cases today. Its death toll is also soaring, with 207 fatalities on each of the past 2 days. And this has led to Malaysia's undertakers working around the clock. The Straits Times' Malaysia Bureau speaks to one of them.
Their white personal protective equipment suits contrast the night sky and their grim task in the cemetery. These undertakers in Malaysia are working overtime, burying the dead.
Paling ramai jenazah yang kita uruskan campurlah jenazah kematian biasa dengan juga jenazah kematian COVID. Sudah 20 jenazah satu hari, siang dan malam. Jadi kerja penggali kubur bertambah dan jenazah pun bertambah.
Despite being in lockdown, the number of COVID-19 deaths in Malaysia has dramatically increased. In just 1 month, from April to May, it shot up more than 5.5 times to just under 1,300 deaths. The state of Selangor is the hardest hit in the country. To cope, the government will add 2 new cremation ovens. And as if a death of a loved one isn't hard enough, family members can only attend the funerals of a COVID-19 patient from afar.
Emosi apabila kita kehilangan orang yang kita sayang, jadi tak dapat nak dekat, tak dapat nak menguruskan secara normal, jadi memang mengganggu emosi waris-waris yang terbabit.
On July 26th and 27th, Malaysia saw its highest death rate yet, with 207 dead on each of the 2 days, even as the country ramps up its vaccination drive. 40% of its adult population has received at least 1 dose of the COVID-19 vaccine. It now has one of the region's fastest vaccination rates. But sadly, for these overworked undertakers, it could not have come fast enough.
You can watch the full clip on the Straits Times' YouTube channel. Now for a closer look, Malaysia correspondent Hazlin Hassan joins me now from Kuala Lumpur. Welcome to the show, Hazlin. We've just glimpsed the workload of Malaysia's undertakers. What other challenges are they facing, Hazlin, and are there plans to help these group of frontliners?
Well, Hariranto, like most frontliners, they are sometimes having to wear PPE for hours at a time, and this can be very hot in our weather and very draining, but this is something that is unavoidable to prevent the risk of being infected with coronavirus. Some undertakers are also still waiting for their vaccinations, especially those outside Kuala Lumpur and Selangor, where the vaccination rate is a little bit slower. But the vaccination rate is now being ramped up, so hopefully they will get there soon. With the death rate still rising, and it is expected to rise even further over the next 3 to 6 months, with the Health Director General saying that the number of daily infections may even reach 24,000 in September. There are delays right now in transferring the bodies to the cemetery from hospitals and morgues, and crematoriums are fully booked every day, and casket businesses are saying that they are facing a shortage of coffins. So in Selangor, the state government is now adding 2 more crematoriums to cope with demand to prevent bodies from piling up at hospitals. And in Kuala Lumpur, the government has opened a one-stop mortuary to deal with this as well.
Hazlin, let's talk about the situation in Malaysia. Now, Prime Minister Muhyiddin Yassin has insisted that the state of emergency will not be extended past August 1st. With that date looming and given Malaysia's high case numbers, like you mentioned, what is the government's stance at the moment?
Well, Hariranto, it is now quite clear that with the withdrawal of the ordinances, which the government had argued was crucial for fighting COVID-19, the emergency wasn't actually necessary in handling the pandemic. So the government is now focusing on the National Recovery Plan and vaccinations. They aim to vaccinate the entire adult population by October, as it is looking more towards exiting the current lockdown rather than intensifying it. So it seems we have withdrawn all the emergency ordinances that were seen as crucial when cases were much lower, but they are apparently not so crucial now when daily cases and deaths are much higher than before.
Well, thank you so much for the updates, Hazlin. That was Malaysia correspondent Hazlin Hassan. Elsewhere, more relaxation expected in England as it's set to allow quarantine-free entry for fully vaccinated visitors from the US and European Union. According to a person familiar with the matter, it could come into force as early as next week. But the US isn't likely to reciprocate anytime soon, with its government advising Americans last week to avoid travelling to the UK because of rising cases. Sydney's lockdown will be extended by 4 weeks to August 28th after the already protracted stay-home order failed to contain the outbreak. The city has been reporting persistently high case numbers, 177 new cases yesterday and 172 on Monday. 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 1 Meanwhile, in Japan, 3 prefectures near Tokyo are likely to ask the government to declare states of emergency for their regions, with the Japanese capital today reporting 3,177 new cases, a daily high for the second straight day. 16 new Olympics-related cases were also confirmed today, bringing the total to 169 since July 1st. But day 5 of the Games is still underway. Singapore paddler Yu Meng Yu is just 1 win away from claiming an Olympic medal after beating world number 10 Kasumi Ishikawa in the quarter-finals. And in the semis tomorrow, she'll face top-ranked Chen Meng. A victory will guarantee an unprecedented silver in the women's singles for Singapore. At the very least, Meng will get another chance in the bronze medal playoff. Unfortunately, Singapore will not have a representative in the women's badminton event after Yeo Jia-min was beaten by world number 18 Kim Ga-eun. Speaking to the media, an emotional Yeo said, quote, "I feel disappointed in myself in this match. I wasn't able to stay calm and adapt to my opponent." Defending champion Simone Biles has withdrawn from tomorrow's individual all-around event due to ongoing concerns over her mental health. This follows the big story out of the Olympics last night when she dropped out of the team final after an underwhelming opening vault. After making the decision, she spent the remainder of the competition on the sidelines, no doubt disappointed, but still cheering for her US teammates and even offering to run errands for them. US Gymnastics said Biles had withdrawn because of a medical issue. She later revealed that it was due to concerns for her mental well-being. The pressure of chasing medals is something the 4-time Olympic champion addressed a few days ago on her Instagram account. After an uninspired qualification effort, she said that she felt, quote, "the weight of the world on my shoulders." Biles has also qualified for the individual apparatus finals on Sunday, but it's still unclear if she'll continue her run in Tokyo. Assistant Sports Editor Rohit Brichnath is here now. Now he is at the Olympics main press center. Rohit, welcome to the show. Help us unpack why Biles speaking out about her mental health was, like what you wrote in your piece yesterday, best move all night.
You have Simone Biles, who has 4 Olympic gold medals and 19 World Championship medals, and basically does things in gymnastics which no gymnast has ever done, and it's an incredibly dangerous sport. So let's not try to teach them about pressure. So when these athletes who have done these amazing things step back from competition, and they have very short lives in sport, right? Simone Biles may not be there at another Olympics. So when she decides not to take part in a competition, we should pay attention rather than saying, they're not tough enough, which I think is absurd. And so I think we should listen to them. Pressure on athletes has gone out of control. I think the emphasis of winning has gone out of control. I think, modern athletes have to deal with social media. They have to deal with people who expect them to be perfect all the time. They have to deal with abuse. They have to deal, gymnasts, for example, have had to deal with sexual abuse in America. So there are so many things that athletes have to deal with. And so I thought she did a good thing, because I feel gymnastics is dangerous, right? The things that she done are dangerous. So if you're not ready, right, then you need to pull out. And I think it's very difficult to do this. So one of the things that happened, which is very interesting, is that earlier this year, the International Olympic Committee produced a mental health toolkit for elite athletes. And some of the figures there, even me, and I've been running sport for a fair amount of time, I was actually astonished by some of the figures. For example, 33.6% of athletes suffer from some symptoms of depression. 49% of them have sleep-related problems. And it's remarkable, actually, because I spoke to a Singapore athlete, a shooter, some weeks ago before the Olympics. And she had tried to qualify for major games, and she had failed by very, very small margins. And she also had a sleep disorder. So I told her, well, actually, you're just one of like 49%. So we need to listen to these athletes. We need to listen to what's going on. We shouldn't feel that we know all the answers. We shouldn't just rely on this old-fashioned view, oh, you've got to suck it up.
Right. Rohit, you pointed out as well, some would say that dealing with mental pressure is all part of the job as a professional athlete. So where is the line between handling the pressure of being in the spotlight and taking care of one's mental health?
So that is key. Pressure, grit is part of professional sport. All these athletes know it. They train incredibly hard. They bleed. You ever seen a rower's hands? They're amazing. They're full of these blisters, some of them blood blisters, and they sweat, they hurt, they pull muscles, they do this sort of stuff. They know pressure. They are the ones in the arena. We are not. I think that's one of the things we have to understand. We don't know what it's like, to have people expect perfection from us all the time. We just don't know that. And so I think, we also have to remember that these athletes are very, very young. Simone Biles is 24 years old. Naomi Osaka is 23 years old. And I think they have been put, some of them, in situations where they are very uncomfortable. And so can they manage pressure? Obviously, because they wouldn't have got to this level unless they can manage pressure. So what is happening? What is it that is pushing them over the line is something obviously we have to investigate. And I think sport has to listen to these athletes and find out what's going on. That an athlete who trains for 5 years to be in Olympics, to be at the Olympics, to win a gold medal, decides to opt out. Just something is wrong. We can't just say that it's too much, that they don't have grit. That, I find that unbelievable that people could say they don't have grit. Of course they do. But something is happening that is making them feel that this is too difficult. So what is it? And I think rather than everybody just, I think people are, some people are being, a lot of people have been quite supportive of her, but there are also people being cruel. And I think it's a time for us to, learn a little bit.
Rohit, when mental health is publicly brought up as a concern, especially by influential athletes like Biles and, like you mentioned, Naomi Osaka, what do these incidents mean for the future of sports, professional sports people, and governing sports bodies?
Yeah, so I think actually it's incredibly brave of these athletes to do what they're doing, because I feel with anything, it's like athletes who protest, whether they're talking about Black Lives Matter or they're doing anything. I think athletes who have big platforms, who have a huge amount of followers, who are quite famous, I always admire athletes who use these platforms, who stand up for things. So I think in a way, Osaka and Biles are standing up for things. They're calling attention to an issue. Now, in that mental health toolkit I talked about the International Olympic Committee, when they ask athletes, what's the main reason why you don't report mental health issues? The number one reason was stigma, because of the way we look at mental health and the way we, our reflex is to say, they're just weak. But of course it's not. It's far more complicated than that. So one of Biles' teammates said a very interesting thing. So some people might feel, oh, she let her teammates down by sort of abandoning them right at the moment of competition. But one of her teammates, I can't remember which one, said actually she understood perfectly, because it is stuff they go through as well. So I think all young athletes, if you ask Singapore athletes, they will probably tell you the same thing. All athletes go through some version of this. This is when the pressure becomes too much and the demands become too much. And so I think coaches have to be very sensitive, officials have to be very sensitive. We've got to listen. You've got to be tough, but you've also got to listen to what they're going through. And I think that's what Biles has done. She's making us have what we need to have, which is a conversation.
Great insights, Rohit. Thank you so much for coming on to the show. I've been speaking with the Assistant Sports Editor, Rohit Brijnath, who is reporting from the Tokyo Olympics. For complete coverage of the Games, visit our microsite at straitstimes.com/Tokyo Olympics. It will be updated very soon with the Team Singapore results, because in a few minutes at 6:09 p.m. Singapore time, Kwa Ting Wen will take to the pool in the 100-meter freestyle heats. And at 6:20 p.m, shuttler Loh Kian Yu will play his group match against Indonesia's Jonathan Christie. And those are our top stories for today. Visit straitstimes.com for more news and videos. Remember to subscribe to our YouTube channel by hitting the red button below. I'm Haryanto Diman. Stay safe and see you tomorrow.